So today we'll be talking about Bloom's taxonomy, matching the objective with the question. My name is Larissa D. Wiley, PAC. I am a candidate for the spring class of 2022 DMSC program. All right, so first slide here is going to be regarding the outline for this presentation. So we'll be doing a brief pre-test to see what baseline knowledge we have. We'll talk about the instructional objectives for today's lecture, the topic introduction, some main points. I'll summarize everything, we'll discuss the references, and then we'll take the same post-test and see if we learned anything. Hopefully we did. All right, so first question. What are the 3 learning domains within Bloom's taxonomy? So I'll give you a few seconds here. Okay, so those learning domains are cognitive, affective, and psychomotor. And we'll talk about those in a little bit. Okay, list 2 of the 6 cognitive learning subgroups. So there's a newer and an older version of Bloom's taxonomy. Either answer would be fine for those 6 subgroups. Okay, so knowledge or remembering is the first. Comprehension or understanding is the second. Application, applying is the third. Analysis or analyzing is the fourth. Synthesis, evaluating is the fifth. And then evaluation or creating is the sixth. And we'll definitely be diving into that more in just a little bit. Question 3. The ability to recall or list information falls under what cognitive learning subgroup? Okay. So if you can recall or list information, that falls under knowledge or remembering. Question 4. A student's ability to explain or summarize new concepts describes what cognitive learning subgroup? So that is comprehension or understanding. Last question. A student is able to create a multiple choice question using an objective-based verb. What cognitive learning subgroup does this skill meet? Okay, so that is evaluation or creating. Okay, so let's get a little deeper into Bloom's taxonomy, and then we'll talk about how we can use it to create our questions for multiple choice quizzes and tests. Okay, so instructional objectives for this lecture. By the end of this lecture, the learners will be able to list the 3 learning domains within Bloom's taxonomy. We mentioned those in the quiz earlier. Explain the 6 cognitive learning subgroups. We talked about those in the quiz as well. Connect a verb to its corresponding cognitive subgroup. Create 2 multiple choice questions using 2 different subgroups within Bloom's cognitive domain. And you'll see in a little bit that I'm actually using the verbs specific to those cognitive learning subgroups in my instructional objectives, which is really important because we want to make sure that our objectives are really specific about where our learning goals are within Bloom's hierarchy of cognitive learning. Okay, next slide here. So here's my topic introduction. This is an explanation of Bloom's taxonomy as a whole. So Bloom's taxonomy was birthed from this book, Taxonomy of Educational Objectives, the Classification of Educational Goals. And Benjamin Bloom was an editor on this book, and this really bred Bloom's taxonomy of cognitive learning. But there's more than just the cognitive learning domain. There's cognitive, affective, and psychomotor learning domains. So I'll just briefly go over those. So cognitive is basically just the mental skills and knowledge that we acquire, and that's falling into 6 subgroups, which we'll talk more about in a little bit. Affective is going to be our feelings, emotions, and attitudes. Okay, so there's 5 subgroups for that. Receiving, so that would be like attentive listening, responding or active participation. Valuing, so seeing the worth of something and really being able to express that worth. Organization, so prioritizing one value over another, such as maybe prioritizing our family over our work. And characterization, so internalizing a value and then letting that value control our behavior patterns. So something, for an example with that, would be we typically marry someone for what's on the inside, their values and characteristics, not necessarily what they look like on the outside, because we know that fades. So that's the affective domain. The third and final domain is psychomotor. So this is physical functions, reflex actions, and interpretive movements, okay? So it's very kinesthetic. So there's 7 subgroups to that. There's perception, which is the ability to apply sensory information to motor activity. So you can see it and then translate that into a motor activity that you do. Set, which is our readiness to actually act on what we're learning. Guided response, we can imitate displayed behavior. Mechanism, we can convert a learned response into habitual actions with proficiency and confidence. Complex overt response, we can skillfully perform a complex pattern of action. Adaptation, we can modify learned skills to meet special events. So maybe an example of that would be you know how to suture. However, you've got a patient that comes into the emergency room with a jagged wound. It maybe doesn't fall under a perfect straight line, so you're modifying what you know about suturing to fit that particular patient need. Origination, creating new patterns for specific situations, similar to adaptation, but just a step above. So now we're going to get even further into what this lecture is truly about. Okay, so we talked about Bloom's taxonomy, the 3 learning domains, cognitive, affective, and psychomotor, and a little bit about each. And we know that we're going to be talking more about cognitive learning domain here in the future. And we can see there's a graphic there on the right side of your screen, and that just kind of goes through the lower order thinking skills up to the higher order thinking skills. But the really, really important part and takeaway of this lecture is that we're not just learning about Bloom's taxonomy. We're learning about how to create instructional objectives that we can really quantify, and how do we write test and quiz questions that assess those learning objectives. And then furthermore, how do we classify the level of difficulty of those questions and learning objectives? So that's why we use Bloom's taxonomy to really give us those gradients or that scale that we so desperately need when we're teaching. So we'll really talk about verb use and how to use the right verb for the question that we're writing or the objective that we're deciding on. And then the different question types, I mean, you can virtually quiz or test a student so many different ways, but the focus of this lecture is going to be multiple choice questions. Okay, so there's just another graphic of Bloom's taxonomy, the cognitive domain, and then those 6 ascending processes in order of complexity at the top. So this is a little bit of a busy graphic, I would say, but I really like it because if we break it down step by step, it's a great graphic to demonstrate what we were talking about with choosing a verb for the situation. Okay, so let's actually start at the bottom, because remember, those are our lower order cognitive objectives. Those are the easier things to learn. So knowledge, okay. So this is our ability to remember facts. This is rote memorization. Maybe we don't really understand the topic, but we just remember it. So different verbs that we would use in our objectives that we write and in our questions that we write would be collect, define, describe, list, memorize, recall, repeat. If you ask a student to recall something, they're practicing knowledge at the bottom of that hierarchy. The second thing is comprehension. Okay, so that's our ability to actually understand and interpret learned information. So we can maybe explain it to another student, we could explain it to a colleague, this concept that we just learned. So verbs that would apply to that would be clarify, contrast, decode, defend, describe, discuss, explain, illustrate, predict, okay? So when we're writing our questions and our objectives, those are the kind of verbs we're going to use for comprehension. Number 3, application. Okay, so this is when we can apply or use learned material in new situations. We didn't just learn it, we don't just understand it, now we can apply it, now we can actually use it. So apply, assess, calculate, complete, compute, demonstrate, interpret, select, transfer, and show. Show is a great one. We're actually showing what we know. Okay, so maybe when we're in clinicals and we're getting to demonstrate some of those knowledge skills that we've got. 4, analysis. So this is our ability to break down information into its different components. So we understand it, we can explain it, we can demonstrate it, but can we really break it down into its idiosyncrasies and really understand it at its molecular level, so to speak. So analyze, appraise, break down, categorize, connect, criticize. Can you compare and contrast it to other things? Can you criticize the information you've learned to make sure it's accurate? Differentiate, divide, examine. This makes me think of clinicals as well. I had a preceptor that constantly said, my pediatric preceptor, and he said, don't just listen to what I say, fact check it. Everything I say, make sure you check. American Academy of Pediatrics, go on up to date, make sure that what I'm saying is true. So analysis, can you be a critical thinker? Synthesis, our ability to put all the parts together. So I learned something in class, I learned something in clinicals, I learned something in the field, and now I'm synthesizing it and putting everything together and really making it work in the real world. Arrange, assemble, combine, compose, construct, create, design, develop, invent, make, plan, prepare. Those are very, all verbs are action verbs, right? But these are actions. You're taking this and you're really integrating it into your world. 6 is the most difficult of the cognitive domains. And a lot of this is going to come with professional development and years of experience and expertise, but we never stop learning. So evaluation, our ability to judge the value of material for a given purpose. So this is even further than, I would say, analysis. This is really critically looking at the information. Maybe we're doing unique research on the topic. Maybe we're compiling a compare and contrast essay, but we're really taking the information to court and assessing it for ourselves. Okay, so appraise, argue, conclude, convince, criticize, decide, evaluate, interpret, judge, rate, recommend. Medicine, the field of medicine never stops growing, and neither should we. So we should be evaluating the information in front of us and making sure that it's legitimate. Okay, so this next slide is going to show Bloom's taxonomy in a different way with the newer revised version of it, and just to give you some context as far as what we're looking at now. Okay, so we can see that remembering is in the place where knowledge was, understanding is where comprehension was, applying is application. And so the words have changed slightly, but the concepts really have not. And I like this graphic, because it's just slightly different than the one before it. Level 1, it's really putting in question form what we're looking for from the learner at each stage. So level 1, can the learner recall or remember the information, right? If you asked that learner, hey, tell me all the colors of the rainbow, and they just told you because they memorized it, but they may not understand how those colors develop or why, or the chemical structure behind it. Level 2, can the learner explain the ideas or the concepts? Can you tell me about what you learned? Can you discuss it? Level 3, can the learner use the information in a new way? 4, can the learner distinguish between different parts? 5, can the learner justify a stand or decision? 6, can the learner create a new product or point of view? Okay, so, and again, we've got on the far right-hand side of the graphic those same types of verbs for each different class, but I like how it asks us the question, kind of makes us think about Bloom's in a different light. Okay, so now we're going to use a multiple choice question example. All of these questions are based on cardiology as a unit, but they're going to be getting progressively more difficult. And we can see how even using just multiple choice questions, we can really elicit those different levels within the cognitive subgroups of Bloom's taxonomy. Okay, so the first subgroup is going to be knowledge or remembering. Okay, so A, question 1, from the list below, identify which of the following is not a chamber of the heart. The right atrium, right ventricle, left atrium, aorta, or the left ventricle. Our answer is on the next slide. So it's the aorta. That's not a chamber of the heart. It's part of the heart, not a chamber. And obviously that's a pretty easy question for various reasons, right? It's pretty basic knowledge, but also we can see the aorta just looks different than the other answers, so it wouldn't be a great question. If I put that on a PA student's multiple choice exam, that would be a gimme, I think. But you get the picture of knowledge is really just identifying, it's recalling. We're just asking them to give us a quick answer. Okay, next, comprehension. So this gets a little more difficult. What best describes the function of the pulmonary arteries? Do they carry oxygenated blood from the heart back? I'll start again on that. Do they carry oxygenated blood from the lungs back to the heart? Do they help blood pass between the right atrium and right ventricle? Do they carry deoxygenated blood from the heart to the lungs? Do they help blood exit the heart and go to the rest of the body? So what do the pulmonary arteries do? Now you have to understand them. So they carry deoxygenated blood from the heart to the lungs. Okay, so the student is not necessarily merely memorizing, although they could memorize that, but you have to have some context and understanding of the blood flow through the heart and what the different parts do. So comprehension. Application. Okay, so even more difficult. So now we're asking the student to take what they know and put it into practice. So you are auscultating your patient's cardiac apex and hear a uniform, high-pitched, late systolic murmur preceded by a mid-systolic click. From the list below, select the murmur you heard. Aortic stenosis, mitral valve prolapse, tricuspid regurgitation, tricuspid stenosis, aortic regurgitation. Okay, it's mitral valve prolapse. Okay, so we're saying you may know all the murmurs, you may have memorized different things about them, but if you were auscultating this murmur, could you apply that knowledge to the clinical situation? Number 4, analysis. Okay, so the verb we're using here is differentiate, and I forgot to mention for each of these questions I underlined which verb we're using because it applies to that particular subgroup within the cognitive hierarchy. So differentiate applies to analysis in this case. So your patient is a 70-year-old female with a grade 4 mid-systolic crescendo decrescendo ejection murmur. From the list below, differentiate the most likely symptom she is experiencing. Dizziness, headaches, unilateral leg swelling, blurry vision, palpitations. Give a few more seconds for this one because they get progressively harder. 5 will take some time to think about. Okay, so which symptom is she most likely experiencing? So that would be dizziness. So this is aortic stenosis, which number 1, I'm asking you to know what murmur it is based on the clinical description. Number 2, I'm asking you to know the symptoms it causes, right? So the aortic stenosis triad is dyspnea or shortness of breath, syncope or dizziness, and angina, okay? So this patient is saying, I'm really dizzy, and you listen to her heart and you hear this murmur. 5, so bear with me, this is a bit long, so your patient is a 67-year-old male with a medical history of uncontrolled hypertension and a myocardial infarction 6 weeks ago. He is non-compliant with his medication regimen from the hospital and has not followed up with cardiology. He does not have a primary care provider. He presents to the clinic with a 3-day history of shortness of breath, at rest and with activity, fatigue, swollen ankles, coughing, and dizziness. He is afebrile with a pulse of 110 beats per minute, blood pressure of 188 over 110 millimeters of mercury, respiring at 20 breaths a minute, and his SpO2 is 92%. On physical exam, you note jugular venous distension, an S3 heart sound, and 2+ pitting edema in the bilateral lower extremities. Your patient appears fatigued and cyanotic. The following care plans have been developed. So decide which is the most appropriate at this time. And hopefully you can see all 4 answer options, but I will kind of read them regardless for you so that you can discern which plan you want to go with. So for this question, I'm combining synthesis and evaluation together. Okay, so because they're just so similar. So we're breaking the information down, all the things we've learned about, and now we're going to put it back together and really critically decide what we're going to do with this patient. So number 1, do we, outpatient, start the patient on a regimen of atorvastatin 20 milligrams nightly, lisinopril 10 milligrams daily, and Lasix 20 milligrams daily, follow up in 2 weeks? Do we admit the patient to the hospital, start supplemental oxygen, bumetanide 1 milligram per IV, nitroprusside, and an initial dose of 5 to 10 micrograms a minute per IV, position the patient at a 60-degree upright angle with the legs dangling over the bed? Number 3, do we admit the patient to the hospital, start IV labetalol at a loading dose of 20 milligrams, supplemental oxygen, and Lasix 20 milligrams IV? Or 4, do we start the patient on a regimen of carvedilol 3.125 milligrams POVID, aspirin 325 milligrams daily, and order home oxygen at 2 liters per nasal cannula, follow up in a week? Okay, so we'll take some time here. So you're not getting graded on this. So there is a wrong and right answer choice, wrong answers, and one right answer, that is. But this isn't going in the grade book. So don't stress too much about this. All right, here's our answer. It's 2. Okay, so the patient is having acute heart failure, decompensated acute heart failure, right? He doesn't look good. He's sick. His vitals look terrible, and he's got evidence of fluid overload and oxygen desaturation, right? So this patient should not be treated outpatient. He needs to be sent to the emergency room if I'm primary care, admitted if I'm emergency room. They definitely want to admit this patient if I can't stabilize him initially in the emergency room. So I'm admitting him. I'm starting supplemental oxygen, Bumex, nitroprusside, and I'm positioning him so that he gets better oxygen. So option 1, we already kind of discussed it. We need inpatient treatment, also rules out option 4. Option 3 is not great because we don't like beta blockers in acute decompensated heart failure due to their acute negative inotropic effects. They can initiate a low dose before they discharge the patient once they're euvolemic, but that's not a great option for when the patient is decompensated, and so we wouldn't do that. Also, we see that there's a beta blocker listed in 4. It's a great beta blocker for patients with chronic heart failure that are stable. Not great for acute decompensated heart failure. All right, so let's move on. Summary. Okay, so Bloom's taxonomy, 3 domains: cognitive, affective, and psychomotor. If I'm teaching students, I want them to learn all 3 of those domains, right? But there's different ways of going about that. If I'm doing the cognitive domains, multiple choice questions, great option, okay? So there's 6 subgroups in the cognitive domain. They go in ascending order of difficulty. And then we can use specific verbs for each subgroup to form our objectives for the course. and our questions that address those objectives and see if our students have learned, and we can use those questions for formative and summative exams. Okay. Here is the reference list that I used. Okay. And then the post-test. I did not break it up slide by slide this time. But hopefully you feel a little bit more confident about each question. So what are the 3 learning domains within Bloom's taxonomy? List 2 of the 6 cognitive learning subgroups, and that could either be the old version of Bloom's or the new version, doesn't matter. The ability to recall or list information falls under what cognitive learning subgroup? A student's ability to explain or summarize new concepts describes what cognitive learning subgroup? And a student is able to create a multiple choice question using an objective-based verb. What cognitive learning subgroup does this skill meet? Okay, so number 1, the 3 learning domains, cognitive, affective, psychomotor. Okay. Number 2, list 2 of any of these 6: knowledge, remembering; comprehension, understanding; application, or applying; analysis, or analyzing; synthesis, evaluating; evaluation, or creating. So I listed the old and the new, but either is fine. The ability to recall or list information falls under what cognitive learning subgroup? So that would be knowledge or remembering, right? So they can recall, they can just tell us, list things, state them. A student's ability to explain or summarize new concepts describes what cognitive learning subgroup? So that's comprehension. I can explain or discuss it to you, teach it back. Comprehension, I understand it very well. 5, a student is able to create a multiple choice question using an objective-based verb. What cognitive learning subgroup does this skill meet? So I would call that evaluation or creating, because I'm creating this new question and critically using that information at the highest level of the hierarchy. So I hope that we learned some good things today. We got a good review of Bloom's taxonomy, especially that cognitive learning group and the different subgroups within it. And then we really got an idea about different verbs that we can use, and that can really help us form our objectives and our questions so that we make sure that we're directing them appropriately and really centering on what we actually want to teach and not veering off into a bunny trail. So, all right, have a great day. Thank you for listening. Bye-bye.